Okay, I think this is a good time to get started. Good morning, everyone. My name is Julie Wong. I am from the Alzheimer's Society of Toronto, and on behalf of the Alzheimer's Society of Ontario, I would like to welcome you to our webinar series. This is our substance uh, use disorders series. So last week we did alcohol. Today, I do apologize for the mislabel. Today is actually cannabis, and next week will be nicotine. Um, a few things for housekeeping. So if you do have questions throughout the webinar, we will be addressing them at the end, but you can always put them in the Q&A and Marilyn will address them if she feels that it fits, but otherwise we will get to as many as we can towards the end of the webinar. This webinar is being recorded. It will be available on both the ALS Educate e-learning platform as well as the Alzheimer's Society of Toronto's YouTube channel. So without further ado, I would like to introduce our speaker for today. Our speaker is Marilyn White Campbell. She is a clinical geriatric addiction specialist with Baycrest Long-Term Care Behavioral Supports Outreach Teams. She is the provincial lead for Behavioral Supports Ontario Brain Change Older Adult Substance Use Collaborative and has recently launched Cannabis and Older Adults, Know the Facts. Marilyn is a co-investigator with Canadian Coalition for Seniors Mental Health Project, which established 4 national clinical best practice guidelines for substance use disorders in older adults, including alcohol, benzodiazepines, cannabis, and opiates, and is co-chair for the Alcohol Working Group. She is the recipient of the Ontario Psychogeriatric Award of Excellence and recipient of the inaugural Seniors Mental Health Outstanding Care and Integrated Practice Award from the Canadian Academy of Geriatric Psychiatry and Canadian Coalition for Seniors Mental Health. With over 35 years of clinical experience working with older adults with substance use disorders, she is recognized as a pioneer in the field of geriatric addictions. She is teach trained through the Faculty of Medicine at the University of Toronto in tobacco education and is a strong advocate to support smoking cessation among older adults in long-term care. So please join me in welcoming Marilyn.
Good morning, everyone. Thank you for coming, and apologies for the mix-up on the titles and topics for today. But I hope you'll join us next week. I promise to make it interesting for you and bring you lots of information on how to support smoking cessation for someone with dementia. So today we're going to talk about cannabis conundrums and cannabis use disorder in older adults and knowing the facts about it. So I'm hoping today by the end of the session, you'll have an understanding of the current research on the use of cannabis in older adults and also an understanding of the practice implications for cannabis use disorder in older adults, and look at the potential, be informed of the potential risks of cannabis use. So I don't have any disclosures. I want to make it very, very clear. I do not have any ties to the cannabis industry. I do not own any stocks in the cannabis industry, and I do not will not be reporting on any industry-sponsored research that purports that cannabis is good to use, because there is a conflict of interest there. So I have no speakers honoraria or consulting fees or in-kind support around cannabis. I have no commercial interests. So I want to just start out by saying that the conversation started a number of years ago. There was a report that came out from the Canadian Centre on Substance Use on improving the quality of life and substance use and aging. So some people think that there's a number of misperceptions when it comes to substance use in older adults, and some things it's not an issue at all, and other people think it's too late to improve the quality of life of someone who uses substances in later life. So, why would you ask somebody to quit smoking after 50 years, or using cannabis or alcohol? Isn't the damage already done? And the reality is, no, it's not too late. So I just want to ask you in the audience today, who are the greatest numbers of, in terms of newest users of Canada? Young people, adults, or older adults? Could you just put your answers in the chat box? So who are the greatest numbers in terms of newest users of cannabis? Is it young people, adults, or older adults? And Julie, I cannot see the chat box. Oh, there it is. Okay, it's come up. So we've got two people, youth, and older adults, seniors. Okay, so we're a 50-50 split. Anybody else? Somebody want to break the tie? So who are the largest number of new users? Youth or older adults? Okay, we have a tiebreaker, older adults. Well, the people who answered older adults, you are correct. So it is indeed older adults. The results of a national cannabis survey indicate that cannabis consumption among pace than any other age group in Canada. So we see in 2012, older adults were not using it quite as much, and 2019, as the cannabis became legalized, we see that older adults, it spiked. And we see that it's the fastest growing segment of the society. And after legalization, they represent over half of the new cannabis users. And we know that there's an issue here because health problems commonly experienced by older adults may promote experimentation with cannabis to ameliorate symptoms. So a lot of people are trying it out, and they are reporting using it for medical purposes, such as managing comorbidities, but they haven't been really prescribed it by physicians. So and the other thing is that legalization has increased research on the effects of medical cannabis on conditions relevant to older adults, like cancer, pain, chemotherapy-induced nausea, vomiting, Alzheimer's disease, and Parkinson's. But there's not a lot of other evidence. So knowledge about the sources and the types of evidence related to cannabis in older adults is limited. So there are several clinical rationales to be concerned about as to why the effects in cannabis in older adults may be problematic. So we know that there is a relative increase in the age group of 50 to 64, and that is 57.8%, and a relative increase in the numbers of older adults over age 65. So that's in the United States and Canada. The numbers are very similar. And an interesting bit of data is that 6.9% of older cannabis users met the criteria for cannabis abuse or dependence. And most of the sample reported that they didn't perceive any risk associated with monthly cannabis use or even weekly cannabis use. So that's kind of concerning because older adults are not seeing cannabis as a harmful substance. So, and here's why. One of the rationales that we, around cannabis is that the older adults, people 65 and older, the younger years in the 60s. And we now know that the concentrations of THC in dried cannabis have increased over the past 2 decades. So in 1995, dried cannabis contained about 4% THC. And nowadays it averages about 15 to 20% THC. And it's not uncommon for people to be sold 28% up to 78%. Some cannabis extracts have concentrates that contain more than 80% of THC. So it's a lot stronger than it used to be. And people are starting the novel users, the new users, people who are starting to use it in later life, are really not as aware of that. And there are also cannabis products that are made up of CBD and contain only small amounts of THC. But again, it's really important for you to check the labels and the concentrations of THC and CBD, and I'll be talking about that later on. So here's the different types of cannabis. I mean, I went on the internet and I just pulled some pictures from the Ontario Cannabis website, and they didn't have the smoked one, but there is smoked cannabis. So the weed, the dried cannabis, and then there's edibles that are available in Canada. So there's cookies, brownies, and chocolate bars, and then there's the gummies, and the gummies come in different flavors and different concentrations. And there's also the CBD oil, so the cannabidiol oil, and the THC oil. So there's so many products out there, it's hard to really keep track. And it's interesting to note that there are also some cannabinoid products that are pharmaceutical grade. So there's nabilone, and you might have heard about that. Dronabinol, nabiximols, cannabidiol. So those are all pharmaceuticals, and the one that's gaining popularity is using is nabilone, and that's a prescribed one that is being used in research to support older adults with Alzheimer's and agitation. I'll talk a little bit about that later on. So there's the inhaled cannabis, so the weed that you smoke, or it can be vaporized, or in a little, just like an e-cigarette, or vaping it through a bong. And there's oral cannabis, the oils, capsules, and edibles. So what about the chemistry and the composition of cannabis? So marijuana is the dried flower and the leaves of the cannabis plant, and it contains over 420 chemical compounds, and 60 of those belong to the chemical group of cannabinoids with psychoactive mood-changing properties. And that's really, really important to note, that those are the ones that can be cause mood changing, that have mood-changing properties. So the cannabinoids are primarily concentrated in those flowers, and it's less concentrated in the leaves and in the stems. And the amount of and the mixtures of cannabinoids vary with the species of the plant and the growing practices and the timing of the harvest. So you don't sort of always get consistency amongst the plants, especially if you're buying it from different sources. The most psychoactive component of in cannabis is the THC, so that's the delta-9 tetrahydrocannabinol. And that THC in the living plant occurs from the non-psychoactive form of THC A acid, or tetrahydrocannabinol acid. So again, it's important to know that the THC has the psychoactive component. So it's that's the chemical that causes the high, or that euphoria when you smoke it or you vape it. Cannabis with THC will reach the brain within 2 to 20 minutes, and it peaks within 4 to 6 hours in older adults. So again, remember that it takes a lot longer as we age. Our body does not metabolize at the same rate as it did in the younger years. So it takes a little bit longer for you to reach that peak concentration. For a younger person, it might happen within 2 to 4 hours, and so for older adults, the concentration may peak within 4 to 6 hours, and it takes a little bit longer for you to come down from it. So the cannabidiol, which is the CBD, also contributes to the medicinal effects, but without those psychoactive properties. So it doesn't cause the mood disturbances. So the use of a variety of strains on older adults experiencing any number of comorbidities, including addiction, depends on the ratio between the two, the primary cannabinoids to reach the desired effect and the function. So the CBD, again, doesn't have the psychoactive properties. The THC has psychoactive. So it will often make the person feel calm, relaxed, or sleepy. There isn't a whole lot of clinical evidence to support its use, but it's commonly used for pain and inflammation, multiple sclerosis, seizures, and difficulties with sleeping. When it's ingested, it will take effect in 2 to 4 hours or longer in older adults. See, there's a question in the chat. No, I did not say, did I say that CBD is psychoactive? It does not have any psychoactive agents in it. I'm glad, thank you for pointing that out. So CBD does not have the psychoactive agent. It is the THC, the tetrahydrocannabinol, that has the psychoactive agents. So nabilone is the synthetic form of cannabis that can only be obtained by a prescription from a physician. And I want to emphasize it's really important you don't share or take anybody else's prescribed cannabis. So there's a link there for from the Canadian Center for Substance Use. There's an infographic. So somebody says, what is CBD for then? So again, I'll just go back to the previous slide. CBD is used for people are using it for pain, inflammation, multiple sclerosis, seizures, and difficulties with sleeping. And there is some research around using it for agitation in people who have Alzheimer's. So is cannabis addictive? It can be addictive, absolutely. People think that it's a natural product. It's not going to harm me. It's, you know, it's just a plant, but it does have some components that can cause addiction. It can lead to tolerance with chronic use. And for people who use it chronically, when they stop using it, the abstinence can lead to withdrawal symptoms, which can include mood dysregulation, so anger, anxiety, restlessness, irritability, depressed mood, disturbed sleep, strange dreams, decreased appetite, and weight loss. So how do you know if you have a cannabis disorder? I like this little poster. It says, dude, we totally forgot our slogan, American Medical Association, Marijuana Association. So the DSM criteria for, so the Diagnostic and Statistical Manual of Mental Disorders for cannabis use disorders is very similar to what you'll see for alcohol use disorder, benzos, opiates, etc. So it's taking cannabis often in larger amounts over a longer period of time than was attended. There's a persistent desire or insignificant effort to cut down or control cannabis use. And a great deal of time is spent in activities necessary to obtain it, to use it, and to recover from its effects. And the other is a key feature is craving or a strong desire to use cannabis. And again, this is something that, you know, is last week, if you attended, we looked at the brain and how the dopamine receptors are activated when there's a substance introduced, such as alcohol, nicotine, or cannabis. And each time you use it and the body gets that euphoric feeling, it reinforces further use. So recurrent cannabis use while resulting in use resulting in failure to fulfill major role obligations, work, school, or home. So that's fairly common. And again, with older adults, those criteria are a little bit different because people may not be working. They certainly may not be going to school, but the role obligations may not be fulfilled because of cannabis use. So not going out to your usual, activities or not meeting with people because you're busy at home using cannabis. So the other is criteria is continued use of cannabis despite having persistent or recurrent social or interpersonal problems caused by or exacerbated by the effects of cannabis. Important social, occupational, and recreational activities are giving up to are reduced because of cannabis use. So if you normally go out and you play bridge, or you go out weekly and meet with people for for some physical activity, and you're stopping that because of your cannabis use, that's something that's concerning. Recurrent cannabis use in situations which are physically hazardous. So using it, for instance, when you are when you're driving, using it if you use an electric wheelchair or scooter, and you're out using it and you're high, that can be a risky situation. And cannabis use is continued despite knowledge of having persistent or recurrent physical or psychological problems that are unlikely to have been caused or exacerbated by cannabis. So, so people who are using it for other health issues and really not getting benefit from it. So we know that it affects older adults differently because older adults have more body fat and less muscle mass and water content in their bodies. And that makes the body break down the substances much more slowly, which means it stays in the body longer. Because of this, the effects of substances like cannabis can be more intense and can last longer when you're older. So as we get older, we have more body fat and less muscle mass. Some of us more than other. I'm, a large lady. So again, cannabis is something that that sort of is not it's not directly doesn't directly go to the bloodstream. It goes and gets collected into the fat and actually into the brain. So the changes can make you more sensitive to possible negative effects such as dizziness, falls, and injuries. So it's important to know that it does affect older adults differently. So what are some of the short-term effects? So increased heart rate, impaired coordination, reaction time, impaired memory and attention, drowsiness, panic attacks, paranoia. And that's usually the paranoia is usually and panic is and the memory and attention is usually associated with the THC, so the smoked cannabis and high THC content. The long-term side effects are risk of exacerbating pre-existing and possibility of psychosis or schizophrenia. We know that cannabis is positively associated with first episode psychosis in young people. And certainly if you have an existing mental health issue and you use cannabis on top of it, it can exacerbate or worsen mental health issues. It also can progress the possibility of cirrhosis and pre-existing liver disease. And certainly we know, again, as older adults, they may be on many medications, and cannabis will interact with different types of medications, such as sleeping pills, tranquilizers, opiates, antihistamines, seizure medications, antiviral drugs used to treat HIV. So there are some long-term effects, and the addiction is often overlooked. It does alter brain development. We know in young people it does affect their brain outcome. All young people have poor educational outcomes. It does affect their cognition, and we know in an older adult there is some evidence that it does affect cognition. There's diminished life satisfaction and achievement. There's also symptoms of chronic bronchitis and risk of chronic psychosis disorders. And there's lower cerebral blood flow than people who don't use cannabis. So if you see the picture of the brain over here, again, this is a brain of somebody who's 18 years old, there's a healthy brain on the left side, and on the right side, it's a daily user of somebody who's 18. We know in later life we're losing brain cells on a daily basis, and so this is not going to be helping anyone's situation in terms of memory and so on. There are risks also for intoxication and poisoning. Certainly risks for withdrawal, because people who use regularly and stop using cannabis may go through a withdrawal. And some of the symptoms are and the most serious one is the vomiting, and it's called cannabis hyperemesis syndrome. And that's pretty serious in older adults, because if you are continually vomiting and it lasts for weeks on end, and you can become toxic with cannabis and continue to vomit. And if you continue to use it, then then you'll continue to have the hyperemesis syndrome. And what happens in older adults is you get dehydrated and can decompensate very quickly. So there is a document out there. It's called the Canadian Coalition for Seniors Mental Health. They have some guidelines on cannabis, and there's three different documents. One is the physician guides, and it's cannabis use disorders in older adults, and then there is also a document, just a journal article with the highlights of the guidelines. So if any of you out there that are listening are working in healthcare, I recommend that you go to the Canadian Coalition for Seniors Mental Health website, and you can download them. And there are also some documents for older adults on how to some of the cautions around using cannabis, and this is one of their recommendations. So they say that cannabis should not be used if you have any of the following conditions. So unstable blood pressure or heart conditions, changes in mental functioning, for example, your memory or concentration, pardon me, difficulty with balance, if there's a history of mental illness or substance use disorder or addiction, it predisposes people to developing a cannabis use disorder. So those are things that you want to be very cautious about. So what should you remember if you choose to use cannabis? So if you're going to use it, then check with your healthcare provider. They can help you stay safe and discuss your cannabis use with them. You want to be sure to read the label carefully for information on the THC concentration. That's really important. If you go to the cannabis store, the people who are selling the cannabis may not be quite that knowledgeable. They may be recreational users themselves and like the high, and so they may not know that there are differences for older adults compared to the younger population, and stronger is not necessarily better. So the recommendation from the Canadian Coalition for Seniors Mental Health is to start low and go slow. So look for products with low THC level, ideally less than 10%. And start by taking a very, very small amount to allow some time for the effects to start, because it can take minutes or it can take hours. And don't take more too soon, because if you haven't achieved that effect yet, it may, if your body's not sort of metabolizing it quickly, then it might take a couple of hours for you to feel the effects. So it's important to really start low, start slow, and really wait. And I'll talk a bit about that in a few minutes. And the other important key message is to buy from a regulated source, and be very cautious about the content of your cannabis products. Read the labels, and again, look at a low THC level. If you're a novice user, don't go higher than 10%. Can you have poisoning from cannabis? there is some research that came out of, where is this? It's very small. I can't remember. I think it's in Norway. It's a European article, and this what happened is this is a report on an emergency department visits by some people who had attended a cannabis workshop, and during the workshop, participants were making different edibles. So they were making gummies and they were making cookies and brownies and so on. And while they were preparing these products, they weren't using any gloves, they weren't using any masks. And so they were, as they were preparing it, they were still, absorbing some of the products, the THC, and when they were finished making these products, they also consumed them. And there were a number of people in this class. They all consumed it, and everyone ended up going to the emergency department. And the striking thing about this article is that there were two people in the class that were older adults, and they were the ones that fared worse. They were the two people that ended up in the emergency department, from the emergency department into ICU. So they did not do very well right away. They ended up in the ICU. They were discharged a couple of days later, but it goes to show you that the toxic effects to older adults is much more heightened than for younger people. So smoked cannabis, is it safe? You'll learn next week when we talk about tobacco that tobacco, as you know, is a carcinogen. And so can we say the same thing about smoking cannabis? So smoking cannabis, qualitatively, cannabis smoke condensates have been shown to contain many of the same chemicals as tobacco smoke. Right, so we know in tobacco smoke there are over 2,000 chemicals, and about 800 and some are known carcinogens. So we don't know how many in burned cannabis, but we know that there's strong evidence that smoke from burning cannabis is carcinogenic. So there's also the cytotoxic and mutagenic potential of cannabis smoke, the condensates that were compared to their tobacco counterparts. In contrast to tobacco smoke condensates, those delivered from cannabis appeared to be more cytotoxic and mutagenic, while the opposite was true with respect to the damage, the cytogenic damage. So for either cannabis or tobacco smoke, the particulate phase was substantially more cytotoxic than the gas phase. So together, these studies suggest that cannabis smoke cannot be deemed safer than tobacco smoke. Okay, so that's a key message, is that cannabis smoke is not safer than tobacco smoke. So why is cannabis use an issue for older adults? Again, the THC, when you inhale it, it goes in pretty quickly. It enters the bloodstream through the walls of the stomach and the intestines. It travels first to the liver, where it's metabolized and mostly eliminated before activating the receptors. And then through that first pass, the remaining THC and the metabolites get to the heart and to the circulation. And the THC and the delta THC reach the brain simultaneously. And again, remember, as we get older, it metabolizes slower, and we have decreased pulmonary function. People may have respiratory disease and lots of other comorbid conditions, medications, benzodiazepines, opiates. So all of these things sort of make it a bit more complex for older adults. So there are some effects and unwanted effects, and we talked about how it affects young people. That is a trigger for first episode psychosis. It is something that affects younger people in terms of their educational attainment and so on. So we know that it similarly affects older adults. As well in cognition. There may be mild impairments in memory, attention, psychomotor speed, and executive functioning. There is suggestion that it failed to yield evidence of severe abnormalities in chronic cannabis use, which is weekly. And people would be likely to perform reasonably well on routine everyday tasks, but encounter difficulties with novel, complex tasks, or tasks relying on heavily on memory or strategic strategic planning or multitasking. And so this maybe have implications for age-associated cognitive impairment and dementia. And that study was done in 2016, and I believe it's been updated by Dr. Porath Waller from the Canadian Centre on Substance Use. And I'll give you an example. I had someone who came to me and said, you know, I had a dog that had arthritis, and somebody suggested that I give it some you know, some cannabis, some THC. So they got some veterinary grade oil, and they gave it to the dog, and pretty soon the dog was, you know, who wasn't going upstairs anymore, was bounding up the stairs and then jumping up on the bed and sleeping at the foot of the bed like they usually did. And they thought, well, gee whiz, you know, good old Charlie, he if that worked for him for his arthritis, maybe it'll work for me. So they consumed it when they were on a trip, and it sorry. So they consumed it on the trip, and they did really well. They had less pain, and they were able to walk about, and they, you know, they had an enjoyable time. But when they returned back to Canada and they had to take on their regular duties, you know, as you know, high-level professionals, they said that their memory was really, really poor, and that they couldn't believe the difference. And so they had to kind of weigh the pros and cons. You know, do I want to be able to move around and, you know, run around like Charlie running up and down the stairs, or do I need to have my, you know, memory back? And it took about a month for the person to really sort of get back to their normal baseline. But they did return to baseline. That's the important message here. So in terms of driving in cannabis, so it has that when if you use the THC in several minutes, and 20% of it is in the blood, and again, it's relative impairment due because the cannabis is more it goes to the brain. It's soluble in fat, so the brain is mostly made up of fat, so it does affect the brain. So daily use accumulates in that fat tissue, and there's residual impairment for the next day. Within 2 months of quitting, there's been evidence to show that it's still detectable in the body. So, you know, you know, when we talk about driving in cannabis, if you consume it, remember that you're going to have some level of detectable amount of cannabis in your system, even 24 hours after using it. So there is a higher concentration in the first couple of hours. Again, remember, for edibles, it takes a little bit longer onset. And again, remember, you know, some people are more novel users. They haven't used it before. And so, you know, how often you smoke it, and or if you're a regular user. So if you smoke it and you've got a high concentration of THC, you can have higher levels in your blood at least 4 hours after consuming it, and that's when you're going to start to feel that high. And again, remember what I spoke about before, you know, concentration of THC, you know, lower than 10%, or it can go up as high as 80%. And we know that that cannabis is 5 times more concentrated than it was in the past. So people who, again, the boomers that used it as, you know, teenagers, you know, you had a joint and you could share it among a bunch of people, have fun, and not have so many ill effects. But now there's a lot of chemicals on the plant, and the THC level is so much higher. It's 5 times more concentrated than in past. There is an issue around impairment. So you can, the roadside sobriety test for alcohol is pretty, pretty standardized, and you can blow into a machine and it can show you what your blood alcohol level is, or your breath, what your blood, what your big, sorry, so your blood alcohol concentration is in your breath. With cannabis, there is a test that shows the existence that the existence of cannabis in your system. So they swab your mouth and it shows that you've been using cannabis. But does it show impairment? Maybe yes, maybe no. So then if they find that you have, and they'll look at your pupils, they ask you to do the same roadside sobriety test that you do when you're using alcohol. But they also would then, if they detect cannabis use through a swab, then they send you to hospital and you have to have blood work done. And I want to point out that, driving doesn't just mean the car. Driving also is for people who are using electric wheelchairs or scooters. You can be impaired. It's not covered under the Highway Traffic Act, but I have been called in many, many times for long-term care homes where people who have been using substances are out in their wheelchairs and weaving in and out of traffic. And you can't be charged under the Highway Traffic Act, but you're certainly going to be charged for nuisance. So we know that, again, with the introduction of legalized cannabis in Canada, there's been an increase in fatalities. It used to be 9% fatalities in the year 2000, and now in 2018, the rates have gone up to 21.5%. So, and the US Canadian researchers say that car crash deaths involving cannabis is on the rise in the US as well. We know that they're doing a really great job doing advertising and knowledge mobilization around impaired driving for alcohol, but we need to be doing more, and we are seeing more out there around driving high. And so there's lots of publicity campaigns around that. Somebody has a question here: how long does impairment last? Again, the cannabis stays in your system. It is still detectable the next day. The impairment depends on how strong it is, how much you've taken, and how, and whether or not you're a novel user. If you're a new user, then you're going to be high for probably a longer period of time. And again, for older adults, there's a period of time that it takes longer for you to come down from that. So how long, maybe this will answer it. How long should I wait to drive after using cannabis? So you certainly have an increased risk of having a motor vehicle accident if you drive while under the influence. And as we age, the metabolism, I keep hammering this into you, the metabolism slows down by as much as 50%. It means it takes longer for the cannabis to take effect, but longer for your body to eliminate it. So if you smoke, you vape cannabis, it'll be in your system for about 25 hours, and it's recommended that you not drive for at least 24 hours after using cannabis. So those are the recommendations for the Canadian Coalition for Seniors Mental Health, to not drive for at least 24 hours after using cannabis. So again, the same rules apply for cannabis as they do for alcohol. You can have your car impounded and lose your license if you're found to be impaired. So look at this one here. This is some data that I got from the University of Victoria, the CSUH Data Explorer, and I looked at emergency department visits. So these are, this is in 2020. So these are the number of substance use attributable emergency department visits in Canada by people aged 65 years and older. And you would think that the other substances like CNS depressants, cocaine, and other substances would cause, and opiates would cause people to go to the ED. And yes, it does for opiates, but we're seeing an increase in the number of ED visits for older adults that are using cannabis. And I was really quite surprised by these results, and I asked them, I said, is this true? I mean, this is the same, we're talking about an opiate crisis, but I'm seeing the same numbers of, very similar numbers of people coming into the emergency department, 65 years and older, for cannabis ED admissions as opiates. And they said one of the issues is that older adults are coming to the emergency department for cannabis-induced psychosis, and hyperemesis syndrome, and also from accidents and injuries from falls and motor vehicle accidents. And the healthcare costs around using cannabis is on the rise. So here's the the one take-home message as well. The difference between smoking, and someone talked about, how long does it stay in your system? This is a graph that shows, and this is again for younger people, not for older people. They're not doing studies on older people, for this type of research. But this is the effect of smoked cannabis versus eaten. So anything, the edibles versus smoked. So if you start out smoking your cannabis, you start out and it peaks almost within the first 20 minutes, and then it has a fast rapid drop, and over 240 minutes, right? So it goes, the drop is quite marked. When you see an older adult or anyone eating edibles, it takes a little bit longer. So you might eat it, and an hour later, again, this is for a younger person, you might start to experience the high, and then you're still high within, in that an hour to 2 hours later. And again, you have to double that for older adults. So it takes much, much longer for the edibles to be eliminated from your system, because it's going through the stomach as opposed to, the smoked cannabis. So is it safer to consume edibles than smoked cannabis? Not really. It seems to be a safer option, but the research indicates that eating the foods that contain edibles carries a lot more risks with it. And as I said earlier, when you eat it, even if it's a brownie or a gummy bear or other means, you may not feel those effects of the cannabis right away. It may take up to 2 hours to feel those effects. And the one thing that I hear time and time again is that, oh, my mom, she has arthritis. We gave her, some edibles, a cookie. And she took the cookie and she took, a little piece of it, and she didn't feel anything. So she ate the rest, the second half, and she still didn't feel anything. She waited a few minutes, she still didn't feel anything. So then she ate the whole cookie. And then we got a call, mom is paranoid. And so we had to take her to the emergency department. So I don't know about you, but edibles are a little bit there's misconceiving, because who eats just a piece of a cookie? So it's very clear on the Ontario Cannabis Store on the content, and it'll show that you break it down into quarters, but they don't sell it broken down into quarters. So so it's very easy to overdose or to take way too much in edibles. The other is the gummy bear. Again, if the THC content is really high and you don't know what the THC content is in the gummy, and you eat the whole gummy instead of maybe just nibbling on the ears or taking the top part of it off or breaking it in half, the whole idea is that start slow and work your way up. But the problem is that people, the perception is that it's like a candy, and if it's in one little gummy, you might as you're meant to eat the whole gummy. But some people need to go really slow and just eat. As I said, some people say, well, I just nibble at the ears, and then I wait until see if I'm getting in the effect, and wait for an hour, 45 minutes to an hour, and then I might take another little bit. So the end result is that delay results in people taking more cannabis than they intend to, which can result in overdose. And again, you start with a small amount and wait to see how you feel after 2 hours. Again, it's not food, it's not candy, it's a drug you're taking. So, and the other thing is that you can experience a really poor reaction, so it's best to go really slow. And the other thing is that, it's something people are very generous, want to share, but it's important that you don't share with other people, because you don't know that your friend or your neighbor or your cousin has other medications on board. So it's really important not to share. So the other thing is to be, buyer beware. This is a picture. You can still get these on the internet. These are edibles that belong to a child's grandfather who has arthritis, and they are sold under the names of Stony Patch and Stoner Patch. And they look exactly like the kids' Maynard's Sour Patch gummies. And so we recommend for, if you have gummies, any edibles, to keep them safely stored. So again, if you're taking edibles, really important not to drive, even smoking, of course, for at least 24 hours after eating a cannabis product, and plan for a ride home with a designated driver, or take a taxi. And keep those edibles and all other forms out of a child's or pet's reach, because they might think it's a dessert, a treat, or candy, and edibles are toxic to both children and pets. And again, we're hearing from the emergency departments, and if you look at the data for emergency visits for cannabis use, we're seeing lots of kids under age of 14 that are going to the emergency department because of cannabis overdose, because they've eaten their parents' gummies or their grandparents' gummies, or the chocolate bar that was left around. So I just want to talk a bit about pain in cannabis. I like this picture. My joints are stiff, and then her friend says you're rolling them too tight. So there's lots of sort of anecdotal information out there. There's lots of people say, well, I use this and it helps me with my arthritis, but that's anecdotal. There's not a lot of clinical evidence to suggest that cannabis is helpful for treatment of pain, but there's anecdotal evidence. And there's some organizations, such as the Multiple Sclerosis Society of Canada, that endorse the use of nabilone to treat pain. So you have to take that with a grain of salt. There can be a placebo effect. So if some people think that cannabis will help with anxiety and depression, and there's no conclusive clinical evidence to suggest that cannabis is helpful for the treatment of anxiety and depression. In fact, it's opposite. The opposite may be true. Cannabis may worsen an individual's depression and anxiety due to the mood-altering ingredients of the THC. Remember, the THC has a psychoactive component. So that if you already have an existing depression or anxiety, it can heighten that. It can make it worse. So this is also a question that we get often. I've had a hard time sleeping. Will cannabis help me? And CBD may have a sedating effect. And if you choose to try it, the cannabidiol, to help with your sleep, you have to, take into consideration if you wake up in the middle of the night, you might be at risk for falls. You might feel dizzy. And if you use it, it does have a sedating effect. So it's important, if you're going to try it, if you're a novel user, just make sure that you've got somebody there in the middle of the night in case you need to get up. So CBD use also carries some risks. It's well tolerated, and it can cause some side effects such as dry mouth, diarrhea, reduced appetite, drowsiness, and fatigue. It can interact with other medications that you're taking, such as blood thinners. So again, really important to have a discussion with your doctor. And I have to say, a lot of doctors are just learning themselves on how to support, use of cannabis and how to dose. People are not, physicians are not all that savvy on how much to even recommend. So there's also the question about whether or not it's something that's helpful to use to manage behavioral symptoms of people with dementia. Is that true? And according to the Alzheimer's Society of Canada, there's a few clinical trials that have shown cannabis to be helpful in managing behavioral symptoms of people who have dementia, including agitation and physically responsive behaviors and expressions, but only in some cases. And they say that, in fact, some studies have shown that long-term cannabis use may be harmful and associated with cognitive difficulties. But if you have Alzheimer's, and the agitation, the physical responsive behaviors is problematic, then for some people it can be helpful. And there are some studies that are coming out of Sunnybrook Hospital showing that it has benefit to help with agitation and physically responsive behaviors. So again, we have to keep our eyes and ears out for the new research. And I think it's Dr. Nathan Herman and Dr. Krista Lanticott that are working on that research, and they're really well-controlled studies. So some of the other studies that are out there, there's using Nabilone. The problem is that some of the people who were enrolled in the study were on other drugs, on other benzodiazepines. So we need to be looking at really good evidence-based studies. So how do you know if you've taken too much cannabis? And so what are the signs of overdose to be aware of? So if you've had too much, you can feel sleepy, anxious, fearful, and nervous. Some people can hallucinate, have visions, and people can feel nauseous and may have vomiting that won't stop. And that's that hyperemesis that I was talking about. And if you have any of these symptoms, please contact your doctor or go to the nearest emergency department. And again, it's important to note that different forms of cannabis may impact you differently, can react with other medications, and it's not a good idea to mix cannabis with other medications or alcohol. So I wanted to share with you some information on how much is in a joint. So again, there was some controversy because veterans were getting 10 grams of cannabis a day, and that's a fair bit. So 1 gram equals 4 joints, and that's a common conversion. So that's what it looks like. We had somebody go to the cannabis store and we put different coins next to it, and you really can't tell much of a difference, right? So a gram next to a dime, a gram next to a quarter, and a gram next to a loonie. So it's very hard to tell. So how much is in a gram? So this is what a roll joint looks like. So there's a 1/4 of a gram at the bottom, which is a typical, pre-roll, and then a 1/2 a gram, and then at the top you've got I call that the Tesla doobie, the one that Elon Musk was smoking when he was on a talk show. So when you look at these pictures, again, if you're a novel user, starting really low with a low concentration of THC. So people ask me in other talks, do topical cannabis creams work? And I have a funny story to tell you. Let me see if I've got my thing out here. Yes, I do. Because people talk about all the time about the different, potions and lotions that you can get out there. And I'm just going to go right. I'll talk about this cream afterwards. So topical creams, they can be absorbed into the body. If you use Voltaren to help with arthritis, you know that can be, if you take too much of it, it's diclofenac, it can cause stomach upset. So, anything that's put into your skin can also be absorbed into your body. But there's no well-designed randomized control studies that exist to inform about the effectiveness or the safety of topical cannabis products. So the few studies that are out there tend to be unblinded. They lack a control group, and they report only subjective outcomes, and they don't talk about the adverse effects of data. I mean, that's one of the reasons, again, I'm don't want to talk about some of the studies that are out there. For instance, they're saying that cannabis helps with seizure disorders. I read a study about that, but then when you dig down further, you realize that that those studies were sponsored by a cannabis company. So, buyer beware. So regarding the absorption, there's no clinical studies that have been published on cannabis containing ointments, creams, or lotions. They tend to be preclinical data on animal. So in addition to areas of research that typically that do not typically match commercial availability for common use, and so if you're using it for post-herpetic neuralgia, so shingles or dermatitis, those things, there's lots of studies out there that talk about the benefits of it, but there's really no evidence to support that it works. And guidelines don't assess, do not assess topical cannabis, or they cite it as an understudied area. So the answer to the question is, does cannabis creams work? I would say that the short answer is no. But I do have a funny story to tell you. So I say, buyer beware. So this is a picture of some cream that I bought. I was at a, one of those outdoor concerts and, festivals in the summertime. And I went into a booth and they had, soy candles, and they had soaps and creams, and there was this Thunder Heat muscle balm. And so I asked the gentleman, what's that for? And he said, well, it's good for pain and arthritis. And he said, put some on and you go have a walk around. And if you like it, come back. You could buy some. So I took it. I have arthritis in my ankle. So I put it on my ankle and I walked around. It felt really good on. And so I came back and I bought it. And I asked him, I said, what's in it? And he said, well, teeny tiny fairies. And I said, teeny tiny fairies. And he said, yeah. And I said, well, it really felt good on. So yeah, I'm going to buy it. I think I paid $35 for it. So I went back home and I was visiting family, and we were, at the table afterwards, and people said, how did you like the festival? And I said, oh, I got some of this Thunder Heat muscle balm. And and so my brother had a shoulder surgery, and his wife said, oh, here, I'll put some of this on his shoulder, that'll make it feel good. And so she took out a big glob of it and she rubbed it on his shoulder, and she smelled it and she goes, oh, that feels good. And she says, I have a bad knee, I think I'll put some on my knee too. So she puts them on her knee. And then my husband said, well, I got a bad knee too, I don't want to be left out, so I'll put some on too. So everybody put a little bit on. And they said, well, what's in it? And I said, I don't know, little teeny tiny fairies. And then I looked on the back and I could just barely see it. I had to get a magnifying glass out to see. And actually, you can see in the little corner on the right-hand side there's a little cannabis, marijuana leaf. But the second or third ingredient is cannabis sativa. So and the things that actually made it feel good was the menthol, the eucalyptus, and so on, the peppermint oil, all those things, and the rosemary on it. That sort of gave me that good sensation. But it did, I did have an adverse event from it because I took too much of it. I put it on my knee and my shoulder, and I put it on. And then the next day I felt really, really quite awful. And I thought, I'm going to go to the hospital. I'm on my way to Guelph. And if I turn around and I go back to Toronto, I feel like the ambulance won't reach me. It's 8 o'clock traffic in the morning, and I think that the ambulance won't reach me. So I'm going to go straight to the emergency department. And actually, as time went on, by the time I got to Guelph, I felt a little bit better, and I didn't need to go and by 11 o'clock in the morning, I felt okay. But there was something in that caused me to have an adverse reaction. So buyer beware. So you don't know what's in the salves, these the chemicals. You don't know how much of the concentration is. There's nothing on this that tells you, it says it's 100% plant-based product, but it doesn't tell you if there's any psychoactive ingredients in this whatsoever. So, be very careful and buyer beware. So in terms of safety tips, we recommend that you keep your cannabis in a locked box or container, just like any prescription. If you're prescribed it, don't share it. If your name's not on the bottle, don't use it. It's really important because, as you've heard me say over the course of this presentation, there are many, many side effects. And again, don't store the edibles in see-through containers where it's easy to see the contents of the bottle because children can get into it. Keep it out of view from children and pets. And again, it can interact with medication that you're taking. Avoid mixing it with other medications or alcohol. And CBD can make you drowsy, which may increase your risk for falling. Take precautions and ensure you have someone with you when you're using cannabis. And never drive high. It's advisable not to drive high 24 hours after using cannabis. And I will repeat that time and time again. Really important to know. So that is all of I have in terms of the slides. Maybe we can go to questions now. It's about 22. So I thought I saw some questions in the chat box. So do we know how long impairment lasts? I think we covered that. Maybe cause opioids needs a prescription and cannabis is easy to get. It's not regulated. Yeah, I mean, that's the thing is that people, generally people are have legitimate pain and they want solutions to that pain. And it's important to, again, have a discussion with your family doctor on managing your pain. Because when pain is untreated, it can affect your quality of life. And you have to find out, is cannabis going to be the panacea? Is the cannabis going to help or hinder your current condition? So are there other questions?
So while everyone is maybe thinking or seeing if they have questions for you, I just wanted to say
Oh.
thank you so much, Marilyn. That was very informative, a lot of information, and you've definitely answered a lot of questions that I personally have heard in terms of the education sessions that I conduct. So just wanted to say thank you for that.
You're most welcome. And I think that my own personal little experience with the Thunder Heat Muscle Bomb was very enlightening for me. And I you know what I have to say, the funny thing is that when I got it home and I read that, I said, oh my gosh, I would have never put that on my body if I'd known I was going to get behind the wheel of the car, because I didn't know if it had a high THC content, if it would cause me impairment. The fortunate thing is I did it right away. I bought it and I got in the car and went home, so it didn't have enough time to sort of metabolize, so to speak. But I really felt upset that I wasn't informed that that was the content of the product. Any other questions?
There's one here. What would you recommend for an older adult with dementia who takes edibles when there's a fear of overdose? This person takes edibles in the form of gummies and worried that it might be one too many.
Yeah, again, you want to check and make sure you know what the THC content is. The edibles, if it's THC, if they have dementia, it is not going to make the dementia any better. It may worsen their cognition. So it's important to, check with that. And having a conversation about whether or not switching to a CBD product may yield better results. So it's, why is the person taking it? Are they taking it to get high, or are they taking it to help with some of the symptoms that they're experiencing? And that's one of the issues for older adults with dementia, for any substance, for alcohol, for gummies, for any medications. It's hard to keep track, and people do tend to overtake medications. So it's important to help the person to maybe to control it. So if the gummies are, if you can control the amount of THC, again, a lower THC level, or switching over to CBD, and treat it like a medication. It's not a candy. It's not, recreationally. Would you be giving that person, free reign to have, 5 or 6 beers or 5 or 6 glasses of wine and then get behind the wheel of a car? No. So I would again recommend taking it a step further and putting it in the pill minder, and treating it like a medication. And try things like cutting them in half, small pieces, and then keeping the package out of sight, out of mind, because same situation with alcohol. If somebody with dementia sees it, and I've had people who were abstinent for 25 to 40 years, and when with Alzheimer's, they see the alcohol and they start drinking again. When they didn't have memory impairment, they never touched it, and they led a life completely abstinent from alcohol, maybe attended AA meetings, were very diligent in making sure that they never touched alcohol. But now with Alzheimer's, they see it and they drink it. So it's sometimes out of sight, out of mind is a good practice. And important to make sure that you're helping the person to understand that that this is, that dosing is important. If they're on cognitive enhancers, if they're taking Aricept to manage their Alzheimer's, this is a drug that's, if you're taking cannabis to help manage symptoms of dementia, it's not going to help your cognition. So it's going to work against them. So it's better to stay away from things that can hinder your recovery, or your chances of benefiting from cognitive enhancers. So I don't know what the situation is, but that's my opinion. And again, it is a drug. It's not. It's and so is alcohol, so are opiates, and people that use it to get high. It's that's a recreational thing. But when you already have other conditions, when you have dementia, you have heart disease, you have diabetes, this can all interfere and interact with those medications. Any other questions? Okay. Okay. So I know last week, I don't know if some of you are in the audience from